Good morning, everyone. Good morning, good morning, good morning. Welcome to A Call to Action. Eliminating compounded disparities for people with disabilities in a year of COVID-19. My name is Jonathan Novick, and today I will be playing a somewhat master of ceremonies role, transitioning and helping to introduce all of the incredible speakers, panelists, and information, content, videos that we have for you today. My name is Jonathan Novick, and I am the Outreach Manager for the New York City Mayor's Office for People with Disabilities. I am a late 20s Caucasian male with achondroplastic dwarfism. I have a little bit of brown hair that's getting a little bit long, a little bit wavy. I'm wearing a button-up blue and gray checkered shirt, and I also have a pair of dark blue glasses. Before we get started today, I just wanted to go over some bits of information for accessibility and all of the ways that you can interact with our program today. So first and foremost, today's webinar is being recorded. The link to the recording will be emailed to attendees and will be available on the AHRC NYC website after May 14th. In addition, today we have access to a variety of accommodations. First, we have American Sign Language. We have American Sign Language interpretation, and because today we are in a webinar format, we will not need, or you will not need, to pin or spotlight. We have taken care of everything. So you should be able to see an ASL interpreter at all times. In addition, we have live captioning. Live captioning is available via our Zoom webinar. If you wish to either turn on, turn off, enlarge, or view a full transcript of the captions, you can go to the bottom of the screen, select CC, and then perform those options. Turn on, turn off, you can adjust the size, but that is available to you as well. And finally, we have Spanish interpretation. If you prefer to listen to this webinar in Spanish, I invite you now to look at, once again, at the bottom of your screen, and there is a globe icon under which says interpretation. If you select interpretation, you can change from English to Spanish. So today, if time permits, the questions that were sent in advance will be addressed at the end of each session, but you may also submit questions via the chat, which I see some folks are already doing. So I encourage you to continue doing so, staying engaged and asking questions, although once again, if time permits, we'll get to as many as we can, but we might not be able to get to everyone. A few quick general notes. It is currently 8:33, and at 11:20, there will be a 10-minute break. So once again, at 11:20 a.m., there will be a 10-minute break. Because we have so many technological features today, it's also important to announce that if you have any technical difficulties during a webinar, you can call our tech assistance line for help, for questions. And that number is, I encourage you to grab a pen now, and we'll be sure to put this in the chat, is 914-557-8568. Once again, that is 914-557-8568. And we will be sure to put that in the chat. Okay. Let's see here. So now on to the presentation. This morning we have a number of speakers that would wish to welcome you. We have Marco Damiani, the Chief Executive Officer of AHRC New York City, Marvin Kislov, the President of Pace University, Phil Thompson, the Deputy Mayor for Strategic Initiatives, Victor Khalisi, the Commissioner of the New York City Mayor's Office for People with Disabilities, Professor Tawara Good, the Director of the National Center for Cultural Competence at the Georgetown University Center for Child and Human Development. So thank you all so much for joining us this morning, and it is now my absolute pleasure to turn it over to Marco Damiani.
Thank you very much, Jonathan, and good morning, everyone. I'm Marco Damiani. I'm a middle-aged white male with thinning brown hair and a beard. I'm wearing a blue suit jacket, a white shirt, a blue tie, and dark blue glasses. Welcome to today's symposium. First, I'd like to thank Pace University President Marvin Kislov for helping to hatch the idea for this symposium in the middle of a pandemic, and Professor Tuara Good for being an essential partner in assembling the A-list of national and regional leaders we're about to hear from today. Special thanks to our symposium partners, PACE, the Georgetown National Center for Cultural Competence, the New York City Mayor's Office for People with Disabilities, the New York City Department of Social Services Office of Disability Affairs, and Trinity Church, Wall Street. Thanks also to the planning committee members listed on your program. They have worked tirelessly over the last few months, actively engaged in an open, honest, and sometimes challenging conversation to arrive at what is a unique and compelling program. I thank them for their extraordinary talents and for their commitment to social and racial justice. At AHRC New York City, we have a mission-driven workforce of 5,000 staff who are committed to supporting people with developmental disabilities to lead the lives they choose. We are proud of our work, but I want to reinforce that today's symposium is not just about intellectual and developmental disabilities. That is intentional. Over the years, the disability community has become fractured and balkanized. This has diminished the potential of our collective power to drive needed legislation, resource allocation, and societal acceptance and inclusion to promote the full rights of people with disabilities. COVID-19 has been a global scourge for over a year now. Millions have suffered terribly. The pandemic has also laid bare the gross inequities experienced by people with disabilities, and in particular, people with disabilities of color. Today is an effort to better understand some of the root causes of this discrimination, the real life impact on people, and to propose what needs to be done going forward. People with disabilities of color who were impacted by COVID-19 often ended up on the fringes of society without the full access to the technology, supports, and healthcare that they deserved. They didn't choose to be marginalized. Was their treatment as second-class citizens intentional? Well, that's really the wrong question, isn't it? Exclusion of others does not depend on willful intent. We don't have to intend to exclude for the results of our actions to be actual exclusion. Robin DiAngelo writes in their book, White Fragility, prejudice is foundational to understanding white fragility, because suggesting that white people have racial prejudice is perceived as saying that we are bad and should be ashamed. We feel the need to defend our character rather than explore the inevitable racial prejudices we have observed so that we might change them. And in this way, our own misunderstanding about what prejudice is actually protects it. The legendary New York Yankee catcher, Hall of Famer, and philosopher Yogi Berra once said, "If the world was perfect, it wouldn't be." So today's symposium is not about making the world perfect. It's about making it more aware and fair, more generous and not judgmental, more humane, more inclusive. Well over 1,000 people have registered for today's symposium, so we've hit on a topic that resonates with many. Let's be sure we learn together and work to activate meaningful change going forward. I'm now pleased to introduce Marvin Kislov, the president of Pace University. Thank you.
Thank you, Marco, and thank you for your leadership. Also, thank you, Jonathan. And good morning to everyone. I'm Marvin Kislov. I'm a middle-aged white male with glasses. I'm wearing a blue shirt and a blue blazer, and I have very thinning gray hair. On behalf of Pace University, I'm very pleased to welcome you all to this important symposium. Pace is a proudly inclusive institution where we welcome and support everyone committed to working hard and creating opportunities. Our OASIS program is one of the nation's most comprehensive support services program for neuroatypical students who want to fulfill their dream of a college education. And our signature educational model, the PACE path, combines academic experiences with real-world opportunities so that students can do the things they're learning about. In other words, we're deeply committed to the kind of work this symposium is focused on, finding ways to support people with disabilities by focusing on their lived experiences and providing opportunities. We're very happy to partner with AHRC New York City and Georgetown University's National Center for Cultural Competence. We have a very big day ahead of us. Many panels, dozens of experts, 2 United States senators. I'll be back at the end of the symposium to moderate a concluding panel on the way forward. For now, let me just say welcome and enjoy this very important topic discussion. Let me also say a thank you to everyone who helped pull this important event together, especially my colleagues, Hillary Nepper and Heather Wells here at Pace University. And now I'm very happy to introduce New York City's Deputy Mayor for Strategic Policy Initiatives, Phil Thompson.
Good morning. My name is Phil Thompson. I'm New York City's Deputy Mayor for Strategic Policy Initiatives. I'm an African-American man in my mid-60s, wearing a gray jacket, a black shirt. I do not wear glasses. I'm not especially good looking. To the leaders and advocates who are watching, I'd like to welcome you to a call to action, eliminating compounded disparities for people with disabilities in a year of COVID-19. Over the last year, we've witnessed COVID-19's disproportionate impact on people with disabilities. This is especially true when you consider the intersection of race and disability and the impact that the pandemic has had on Black, Brown, and Asian communities. In New York City, nearly 1 million people self-identify as living with one or more disabilities. Of that number, approximately 69% also identify as people of color. Our vision for an inclusive COVID-19 recovery must consider how disability intersects with race, poverty, gender, and all the other issues that affect a person's ability to function and prosper. I was raised by a single mother with a disability, so I know how hard the struggle can be. And I also know that people with disabilities are capable of doing extraordinary things and making great contributions to this city. By making our city more inclusive and considerate of everyone's needs, we will also make this a healthier, happier, and more prosperous place. The New York City Mayor's Office for People with Disabilities is committed to ensuring health equity for all New Yorkers, and including people with disabilities. We've worked on coordinating free food delivery services, delivering PPE items for people with disabilities and their caregivers at the height of the pandemic. And we continue to work for the equitable distribution of COVID-19 vaccine and physical accessibility of New York City vaccine centers. But there's a lot more to do. With that, I look forward to working with you all to continue to address disparities laid bare by the pandemic. And I'd like to introduce New York City's wonderful Commissioner of the Mayor's Office for People with Disabilities, Victor Khalisi.
Hello, everyone. My name is Victor Khalisi, and I'm the Commissioner of New York City's Mayor's Office for People with Disabilities. I am a white male, wearing glasses with salt and pepper hair, wearing a blue blazer with a pink striped shirt. Thank you so much for joining us today for this important conversation on the intersection of disability, race, ethnicity, culture, gender identity, and more. In the last year, we have experienced one of the largest health crises of our lifetime. The ways in which we work, educate our children, stay connected with friends, family, and loved ones all came to a screeching halt due to the COVID-19 pandemic. As resources and services were being stood up, it was glaringly apparent of the disproportionate impact that this was having on the disability community, in particular, people of color within our community. Access to food, access to home health care providers, access to medical equipment, and even access to information were unfortunately scarce for many people with disabilities. As we consider equity and accessibility for people with disabilities, we must take into account the intersectionality within the community and what that means for each person. Today, we dive deeper into this topic. As we are coming out of COVID-19 and establishing what life will look like again, we cannot afford to leave anyone behind. Thank you.
Thank you very much, Commissioner Khalisi. We're going to continue with remarks. Thank you so much, Commissioner Khalisi. We are going to continue with our opening remarks. It's my pleasure to introduce Tawara Good, the Director of the National Center for Cultural Competence at the Georgetown University Center for Child and Human Development. Thank you so much for joining us this morning.
Thank you so much, Jonathan, and good morning to everyone. I'm an African-American woman with brown skin, hair in natural twists with some graying going on there, wearing glasses and a purple top with my very favorite silver and amethyst necklace, and also silver earrings. On behalf of the Georgetown University National Center for Cultural Competence, I had the distinct honor of collaborating with Marco Damiani and served on the committee that planned this timely symposium. I applaud all who had a role in making the symposium happen and strongly encourage all participants to heed this clarion call to action so that we can ensure the health and well-being of persons with disabilities, not only during a public health crisis, but in the day-to-day reality of their lives and the communities in which they live. Thank you.
I'm very pleased to introduce Senator Chuck Schumer. Senator Schumer is the Senate Majority Leader and Senior United States Senator from New York, a seat he has held since 1999. He's the Dean of New York's Congressional Delegation and previously served in the U.S. House of Representatives and in the New York State Assembly. Majority Leader Schumer's steadfast leadership and relentless fight to lift up not only New Yorkers, but all Americans has been a beacon of light for all of us over these past dark months. I'm pleased and honored to introduce Senator Chuck Schumer to offer opening remarks.
Hey everybody, this is Senator Chuck Schumer, and to AHRC New York City, to Pace University, and to Georgetown University's National Center for Cultural Competence, thanks for letting me join you in today's symposium. And thanks to Marco Damiani, Marvin Kislov, and Professor Tawara Good for your leadership and for bringing us together during these hard times. Our country stands at a crossroads. With each passing day, we get closer and closer to putting this awful pandemic behind us. But even so, we simply cannot return to the way things were before. COVID-19 put a magnifying glass on so many inequities and injustices that existed long before the pandemic. And once COVID started, few suffered more than people with disabilities, especially those from communities of color who identify as LGBTQ. They faced additional barriers to healthcare, all have underlying health challenges, and often cannot care for themselves. When this crisis is over, we must work together to make sure we provide real care, dignity, and support for all people with disabilities, no matter who they are or what they look like. And it's why I'm so grateful to all of you, the advocates, policy experts, nonprofit and faith leaders who have worked for years in New York and across the country to serve people in need and create real lasting changes in our public policies. Your work literally saves lives. As Senate Majority Leader, I promise every day I'll stand by your side. That's why I championed and secured HCBS Medicaid funding in the American Rescue Plan that will deliver $1.2 billion to New York. These resources will help our communities deliver compassionate care to those with disabilities in the safety of their homes and communities. And I also promise to work with President Biden to deliver on his Build Back Better agenda that will transform the caregiving infrastructure, serving millions of Americans with disabilities and ensuring that everyone can live healthy and dignified lives. That's our mission in the months and years to come, and I will work with each and every one of you to make it a reality. Thank you very much.
Thank you so much, Senator Schumer. Thank you for your inspiring words and your powerful advocacy for all New Yorkers.